Thank you so much for joining us. My name is Charlie Gearing. I'm a member here at Weaver Johnston Nelson PLLC. I am a 15-year litigator. Started out my career at Haynes and Boone, one of the biggest law firms in the state and in the country, and then practiced for a number of years at Figueroa and Davenport, one of the foremost and most respected litigation boutiques in the country. And throughout that time, I have developed a small expertise in litigation surrounding non-competition covenants, which we will refer generally to as non-competes today. We're so glad you could join us for this CME presentation about recent developments in physician non-competes, specifically in North Texas. We're going to talk a little bit about what these agreements are, how and when they are enforceable, and what recent changes in the law or that you may have heard about in the news and otherwise, and how those changes affect their enforceability now and going forward. So just getting started, a quick disclosure and disclaimer. Generally, the information and opinions in this course and any other supplemental materials should not be used or referred to as primary legal sources, nor should they be construed as establishing medical standards of care for the purposes of litigation, including expert testimony. The standard of care is dependent upon the particular facts and circumstances of each individual case, and no generalization can be made that would apply to all cases. The information presented should be used as a resource, selected and adapted with the advice of your attorney. It is distributed with the understanding that Weaver Johnston Nelson PLLC is not engaged in rendering legal services to you or any other participants in this CME. So please just remember, this is not intended to be legal advice. As you will hear, non-competition disputes are intensely fact-dependent and fact-specific, so we recommend that you always hire your own counsel to counsel you in the event of such a dispute. Next, you'll be glad to hear that you're getting a ethics credit for this CME today. We designate this live activity for one AMA PRA Category 1 credit. Physicians should claim only the credit commensurate with the extent of their participation in the activity. So, if you watch half, maybe you can claim half an hour. If you stick around for 45 minutes, maybe you can claim 3/4 of a credit. So, but our firm, Weaver Johnston Nelson PLLC, is accredited by the Texas Medical Association to provide continuing medical education for physicians, and we've designated this course for 1 credit of education in medical ethics and professional responsibility. All right, so our agenda for tonight or today, first we're going to go over non-compete basics. What are these agreements? What's required for them to be enforceable and the like. Second, enforcement considerations. There's, what the law says and then how the law plays out. So when a party seeks to enforce a non-compete, there are some specific things you should keep in mind. Third, notable North Texas decisions regarding non-competition covenants as they relate to physicians. And fourth, non-competes in the news and in the future. We're going to talk about the FTC's recent action over the past year and the changing political environment here in the United States and how that may affect enforceability going forward. And then fifth, best practices for physicians concerning these non-competition covenants.